Donor Network West is the federally designated organ procurement organization for Northern California and Northern Nevada. We're one of 56 organ procurement organizations in the nation, and we are the organization that facilitates organ, eye, tissue, and research for donation and transplantation. Our service area is unique in that we have a very diverse population that we serve. There are over 14 million people in our service area, and in that makeup, 60% are people of color. It looks the same on the wait list. There's over 100,000 patients that are waiting, and 60% of them are people of color.
When you look at the recipient side, which is people that are receiving those organs, it's only 51% of people of color that are recipients. So you can see there is a huge gap between people that are on the wait list versus people that are actually receiving the organs. 20 years ago, that number used to be 35%. So we made a lot of progress as an industry when it comes to getting people of color more access to organs for people that are on the wait list. However, there is a huge gap that exists today when it comes to people of color and how much they're donating. Only 35% of last year's organ donors were people of color. 20 years ago, that number was 27%. So as you can see, we haven't really moved the needle much in the last 20 years. And without donors, there cannot be any transplantation. So it's really important that we focus equally on the donation side as well.
You know, when looking at the disparities by the numbers, we're seeing a growing need for multicultural, families to say yes to donation. We pair better with those backgrounds that are alike. And, it's longer term for that graft survival. Regardless of all the science and the things done, it's proven that we pair better to people like us.
We have to dispel the myths and misconception around donation and transplantation. There is a distrust of the healthcare community overall, and it has an impact on donation and transplantation too.
I feel that Donor Network West has made that a priority in our values and in our mission to be more diverse and to really embrace DEI.
When I began at Donor Network West in 2019, there was no one on executive leadership that looked like me. And as I began to study our population, I recognized that we did not represent the population that we served, and that is so important, not just by race, but also diversity of thought. Donor Network West has really focused on the population and the community that we serve, both from an education standpoint, but also in how we approach potential donor families within the hospital. On the education side, we try to identify by meeting them in focus groups to identify what the concerns are and focus our education and training around what their concerns are. And then also what we do on the donation side is we make sure that people that look like them or people that have been trained and educated to understand that particular culture are the ones that go and talk to them about donation.
Working within our clinical operations, it's been important for us to make sure that our families of color are well represented on our team, and having that diverse background from our internal operations with our team has allowed us to understand the needs of our families and make sure that we're providing the best care that they can to say yes to donation and save and heal lives.
The community here at Donor Network West is very diverse. It incorporates many different cultures, backgrounds, upbringings. And because of that, we have really strived to be a representation of that community that we serve.
We've found that by doing that, we've had a huge increase in donation amongst people of color.
Donor Network West has had record-breaking last couple of years where we did more donors of people of color, and that can be attributed towards the awareness, the intentionality, and the focus that we have so that we can narrow and ultimately close the gap that exist on the donation side.
Donor Network West is really focused on is outreach to these minority populations and educating the need in their own communities for transplants and the importance to register to be a donor.
At Donor Network West, the strength is in diversity. We've been able to have a representation of our communities that we serve, and to be able to look at these families and be able to bring people that have like minds in order to make it comfortable for families to say yes to donation.
There is a lot of improvement that needs to be made with people of color, especially on the donation side of things. And if we are able to do that, then we can easily add 5,000 additional organs for transplantation every year. And that is huge when it comes to our industry. And it's also equally important because census data shows that by the year 2045, the majority of our country will be people of color. So the time to really start working towards that is now.
The future of organ donation and transplantation in this country looks bright, but there's some things that we need to do. And I think Donor Network West is at the forefront of focusing on people of color in this country. But without people of color being educated, we're not going to eliminate the wait list.